Welcome back, everyone. We are so honored to welcome our invited guest, Dr. Maria Fátima Chilaca Rosas from the National Oncology Hospital at the National Medical Center Siglo XXI IMSS. Please give a warm welcome to Dr. Fátima Chilaca Rosas.
Thank you. I appreciate the invitation of this committee. It's an honor of this conference. I think it's a great forum. Talk about the innovation of intelligence, artificial, and neuro-oncologists in specific. Well, my name is Maria Fátima Chilaca Rosas. In this moment, I am head of service of radiotherapy, and I talk about the interest of my service. Well, the program for this conference is the introduction of radiomic, and it's important the remark the radiomic is one part of omics of science. In the last 10 years, joined each omic, transcriptomic, genomic, and in this moment, radiomic is with the focus of include these designs for in the researchers and physicians, aperture the understanding respect biological oncology in specific in my area, neuro-oncology in specific. Well, remember, the focus is the application, early diagnosis, and prevention of disease development. Well, I am radio-oncologist, but I have a subspecialty of pediatric radio-oncologist, and so important for me in the clinical practice daily, the understanding of pathophysiologic of each entity or combination related the oncologist disease and another disease just like diabetes and when the patient stay or course with everything is complicated, analyze the only entity of this disease and in a specific gliomas or glioblastoma in the before classification of WHO. Now is another classification with advance of epigenetics. We advance with join the genomic, transcriptomic, proteomic, and now the oncologists evaluate evaluate everything, clinical, biology, and paraclinics studies, and this is a probability and projection, the probability of prognosis of progression or survival of each patient. But is in today in Mexico is a great it's a new perspective because in Latin America the concept of precision medicines is only the opens the door of implementation, is far for implementation because we have to collaboration and structures in different points of Latin America. In a specific Mexico City, only have one or two groups of new omics collaboration together. And so this is an invitation to collaborate because in my hospital is a reference of national center, and the prevalence of neoplasias in pediatrics or adults is leukemia, gliomas, breast cancer, lung cancer, And the precision of radiotherapy is the first point of that I have to offer the treatment precision and personality treatment. So I help for many software and each part of biology and paraclinics studies, just like PET, just like tomography, resonance, MRIs, and everything I have to analyze. But sometimes the times of analyze in segmentation in today is extensive and results in big data, so complicate for clinical understanding everything the data. So this is the relevance of utility and utility of intelligence artificial. So this is the objective of our project, focus, join everything information, the big data, in a specific digital imaging of oncologists is in previous publications in the 5 last years, I published about focus with the shape and texture in respect, just like to see the specific zones or segments of tumors. And these characteristics are transformed in dimensional data in matrix that can I analyze in these platforms of radio-oncology. That this is the this is another option, quantitative to clinician precise and personalized treatment. Well, the purpose of the last article in we collaborate with Dr. Altamirano. Structure, well, we'll together structure the first flows of the first steps when I analyze, just like clinical, biological, and other analysis, just like epigenetic or genetic determinations. And after the digital imaging, but with analyze in just like radiomic, and that parameters in a specific I focus for texture and try the project and new models that can I predict the probability of progressive in a specific glioblastoma or glioma diffuse in a specific midline because the poor prognosis is only 12 months. I'm sorry, 12 months with everything treatments that can I offer just like radio-oncologists. Well, so this is for we have tried structure logical oncologist fluid or flows in respect of priority of each patient. And this is the proposed because in the practical of radio-oncologists or another oncologist is complex and is a new proposed that can we predict the prognosis, not only in the progressive, it's in another perspective, just like quality of life. That is the most relevant point for us, just like an oncologist. Well, I appreciate your time, and now Dr. Altamirano continue with this interest project, and so I'm excited about that collaboration. Thank you. Yeah.
Ajá. Sí. Thank you so much, Dr. Fátima. Our
Okay.
next lecturer is by Dr. Myriam Altamirano-Bustamante, a physician scientist at the National Medical Center Siglo XXI of IMSS. Her interdisciplinary research brings together bioethics, metabolic disorders, and accessible diagnosis technologies. Today, she will bridge radiomics and AI to improve glioma prognosis and patient care. Please give a warm welcome to Dr. Altamirano-Bustamante.
Thank you very much to the organizer of this summer school, fantastic summer school. It's for me a pleasure to stay here to share our knowledge and experience with the young people that are very enthusiastic about artificial intelligence and its application on medical field. One of the things we are interested in is to introduce you in the use of the expert knowledge using science, philosophy, and bioethics as a core of the all new technologies. And one of this part of this study is a systematic review and epistemic meta-analysis of radiomic gray glioma progression framed with PO and Prisma focus. What is a epistemic meta-analysis? It's an approach using research to analyze and synthesize existing knowledge, theories, or findings. On this research, the term epistemic refers to examination of knowledge, our understanding, evaluation, assumption, methodologies, and theoretical frameworks of a new binomial we call ID, artificial intelligence and radiomics. Is a field, an interfield that can be amalgamated with the science philosophy using the landscape, the epistemic landscape, and identifying the gaps in the knowledge. That is the case of ID studies. The precedent required to first create a puzzle construction by epistemic meta-analysis. When you have heterogeneous results with different metricas, that is the case of ID field, that each research publish different data in different data sets, in different metrics, that they are not comparable. For this reason, we do the epistemic meta-analysis. The idea is to identify what was done, what were the objectives, the subdivision, the cancer type, the specific article information, what is the model, what is the performance of the model, and how it was done. All the radiomics features, all the information about image, and the development of the model. How was the cross-validation, the optimization, and the software. We identify the what and the how it was done. This is very important to be able to compare different studies. The first thing we did was to classify all the studies. We take 19 studies that we analyzed by epistemic approach, and we identified 11 that work with prognosis, 6 the post-treatment progression, and 2 of segmentation. These are the groups. And one group use as well classification. This is the first approach. Identify the landscape and look what are in the field. With these things, we construct several tables with the what's that include the study context, topic, clinical data, objectives, and model performance, specificity, sensitivity, itability, how include segmentation, regions, automatization label, feature, feature type, extraction the software, sample size, etc. We published this in a scientific report paper in this year with all the information of these 19 studies. The roadmap of the usually radiomics field is image preprocessing, segmentation, feature extraction, feature selection, analysis and machine learning modeling, machine learning and validation with the rod curve, and the outcome that is the prediction of what is the best prognosis of this for this patient. This is the roadmap, but the problem is that all the data are different metrics, different approach, different scanners. For this reason, we do the epistemic meta-analysis using this. We propose the mean map for prognosis utilizing the Chang word. We have all the characteristics of the study, the data of the model, and the radiomics and clinical features. With this, we can bet the strengths, the methods, and the outcome at glance for prognosis tasks. And we did the same for progression after treatment, but now with the Patel study, and we have exactly the same, the objectives and the identification of the paper characteristics, the model characteristics, the data is the feature clinical and radiomics features. And this we can highlight the templates comparatively across stats. With these maps, you can overlap in each map and identify the constant regions and the variable regions between the two maps. And you can identify what is the difference in each model and what are the constant features that we can identify for the prognosis. And this is made able to mean the gaps of the knowledge. For this, after this analysis, we were able to propose a pipeline to develop and implement an hybrid model. And we call Fall 1 the development, Fall 2 the implementation. And these are the 8 steps of the development and the 4 steps of the implementation. Something that is very important is to perform innovation in the ID field. The innovation depends on how you can empower the people, in this case the oncologists and the radiologists, how you did a treatment and shaping innovation capabilities in the hospital, feature innovative organization, enthusiasm, motivation to change, tolerance on mistake, appreciation of creativity, openness to risk, yes, open innovation culture. With this, we identify the Fall 1, and we can make a standardization and sequence. This is very important. Keep the scanner and parameters consistent, slide thickness, gut brand. This is very important to be comparable between the different studies. In the development, the segmentation is important for prognosis to segment 3 regions, tumor, edema, and necrosis. The feature extraction use the gray scale and the molecular variables. The training and the test is very essential, and the feature selection and training to be and operate in a cyclic loop. And finally, model comparison and final testing and reporting. It's important, for example, in the studies we identify only few papers report the the rod curve, accuracy, sensitivity, and specificity. We need to check the overfitting and do not tune to the test set. This is very important. And after we have the fall 2, que es the implementation. And the implementation is the architecture of all the system. How you want to apply in the clinical application, patient data, run the pipeline, and present the classification and its explanation to the oncologist. You can make a different decision making, a more integral decision making for the oncologist, and give a better treatment personalized for each patient. This is the implementation, the input, the data, the radiomics data, the clinical data, the molecular data, the run of the people in the model, prediction, how to predict the prognosis of the patient, and display patient communication. And this is the process, development with the age steps, and this to make a prognosis, and you can take a threshold. First, hay una pseudo progression or early progression. This is made the prognosis, patient stratification, and this is related with the natural history of cancer, suspected cancer, cancer diagnostic, treatment follow-up, treatment file, and in some cases the death. This is correlated with the historical natural disease, and it's very important to have patient stratification and prognosis. With this, we can say that using epistemic meta-analysis, we can have a navigable roadmap para interpretation, diagnosis, prognosis, treatment, and follow-up. Clinical reporting guidelines, the rod curve, accuracy, sensitivity, specificity, and integrating molecular biomarkers, outlook, position, area, and interdisciplinary collaborative field. This is very important. To be able to collaborate, we need to speak in the same words, in the same metrics, to be able to compare the data of the patients, the radiomics feature, the clinical feature, the molecular feature. And this is important to have a science-based evidence, apply approach precautionary, predict methods is very important that we are doing modeling, technology of humility to be able to what we can do and how we can do, and social experimental to have a bioethical principles, vulnerabilidad and distribution, and control del dilema. This is important to integrate the bioethics and the science philosophy in the ID field, because in the ID field, the people just taking in evidence-based medicine and forgot about values-based medicine. That is very important how you can do. And conclusion, we need to control the dilemmas appeared in the process, the anticipation and the incrementalismo. Anticipation consequence, constructive technologies assessment. This is very important. is essential the assessment, value-sensitive design, responsible innovation, ethical, legal, and social implication, responsible research and innovation, and monitoring. This is important, monitoring the effects. And we can see that the Radiomics ID for predicting high-grade gliomas progression is a paradigm shift. Now we have a structured roadmap to standardize reproducibility and clinical implementation. We can do with random forest, implication next step, standardized frameworks and automatic workflows, multi-center, promote, prioritize, multi-center data set, molecular clinical biomarkers, and rigorous validation for real-world deployment. This is very important, the validation, the assessment of all this approach. Thank you very much to partners, the Hospital de Oncología del Centro Médico Nacional Siglo XXI, el Instituto Nacional de Pediatría. Special thanks to all the investigators, all the researchers that are working in this field. María Fátima Chilaca, Manuel Tadeo, Federico Palash, Nelly Altamirano, David Rafael Salazar, Cristina Revilla, Juan Carlos Heredia Gutiérrez, Benjamín Conde Castro, Rafael Medrano, and thank you for your attention.
Thank you so much. Thank you so much, Dr. Myriam. We have a few questions from the Zoom meeting. Would you like to answer them? They ask, in the long term, could radiomics-based AI reduce the time between diagnosis and personalized treatment planning in the future?
Yes, that's the idea, to do a personalized medicine, to identify each patient, each pattern, and the follow the each patient. Maybe Dr. Chilacas want to talk about it. ¿Ya no está?
Yeah. Yeah, I confirm the new perspective of oncologists is the precision treatment and precise, and this is necessary the support of digital imaging analyzed in terms of different dimensions, just like textures, intensity geometry, and after projection, the treatments specifics include radiotherapy.
Thank you so much. And we have
I don't
another
know.
question. Do you envision these models as a tool to make decisions, or you think that in the future it could be the point of care as a mainly decision making?
It's very important that the idea is to have this model to help decision making. It's essential for personalized medicine. It's a help for the medical doctor, for the oncologist, but it requires the oncology. The oncologists are required. They are the expert knowledge. The artificial intelligence is a tool that use rationally and bioethically to really improve the outcome of the patient.
Thank you so much. And in the next 5 to 10 years, how do you envision that these technologies will change patient care?
These technologies already are changing the patient attention. It's already changing because now the doctors can process the image in very small time, in very short time. In 1 or 2 days, they have the new interpretation of the image and can make the prognosis. And this can be a decision making more integral, more personalized, and more specific.
Thank you so much to both doctors for sharing their expertise in this kind of topics. And can we give an applause to both of them?
Gracias.